Entia is an oncology services company that is really focused on unlocking the full potential of cancer therapy using at-home blood monitoring. So if you look at a cancer patient's journey, quite often throughout therapy, an individual may be brought into hospital up to 10, 12 times just for routine checkups to see how their health is progressing. Now, often key to that assessment is blood testing. And if those blood tests could actually be done in a way that actually worked better for the patient and could be delivered outside of a hospital or clinical setting, that is freeing up a huge amount of capacity for nursing teams to actually focus on really sort of operating at the upper end of their license and really sort of delivering high quality treatment, either through bringing more patients through the system or actually be able to spend more time focused on those individuals who really need their attention. At the heart of our innovation is Liberty.
We put a device in patients' home where they can have access to blood results instantly and avoid kind of all that kind of emotional energy that goes into those long trips kind of to hospitals and nervous wait in waiting rooms, waiting to see a doctor to see how you're doing. Only to be told a lot of the time that actually you're doing really well, and actually you could be at home enjoying a cup of tea while waiting for kind of the blood test and saying, actually, this is going all right.
So one of the challenges that we see within oncology practice is actually a lack of data, and that data actually being used to guide personalised treatment. But once they complete that blood test, we also have the entire infrastructure around it to allow for the uploading of results to the cloud and for those insights that have been derived from the analyzer to be shared back with healthcare professionals wherever they may be in the world.
Innovate UK, with its biomedical catalyst funding, actually allowed us access to money and prove out a lot of what we were doing in the early stages, which was hugely beneficial for ramping up our acceleration later in the development process. And actually it was huge having the UK government look at our kind of technical kind of capabilities and say, actually, this is worthwhile. This is so important for patients in the UK. Be able to prove that it was really easy to use by patients, taking the complexity out of kind of traditional blood analyzers and being able to allow someone in the home environment to use it. Was all generated through that Innovate UK funding.
Liberty has a really important role to play within the US healthcare system, and particularly around cancer, addressing one of the most high-cost complications associated with therapy, febrile neutropenia. When a patient finds themselves with a suppressed immune system and an infection, this can lead to a lot of complications. And what we find is that currently about over $11 billion is being spent every year in the management of febrile neutropenia. Liberty has the benefit of being able to really get ahead of this complication and identify those who are either healthy and no longer need triaging into the ER, or actually to support patients in their recovery of febrile neutropenia within the community setting. Now, this creates a multi-billion-dollar market for us as an organisation, which longer term has huge benefits for the UK economy. Here at Entia, we've already found ourselves at the forefront of an emerging market that is growing incredibly quickly. We are currently the world leaders within at-home blood monitoring. We have an incredible opportunity here to transform the face of cancer care using the insights generated through our Liberty service. So Innovate UK funding has been absolutely instrumental to the success of this business. And so I think having access to Innovate UK funding gave us the partnerships and the opportunities to really sort of accelerate that product development and then really bring forward our timelines, both in reaching market, but really actually sort of supporting patients. And that just wouldn't have been possible without that funding.